Knowing how to put someone into the recovery position is a key skill to have, especially if you'll find yourself in an emergency situation where someone appears to be unconscious but is breathing normally.
In this chapter, we're going to talk you through the correct procedure so that if that situation ever arises, you will know exactly what to do.
The first thing to do when finding someone lying unconscious is to check for danger. Make sure the casualty, any bystanders, and you are safe. Then check response. Gently shake their shoulders and ask them loudly, "Are you all right?" If they don't respond, shout for help. "Help! I need some help over here!" Next, you need to open their airway. When someone's unconscious, the tongue can sometimes fall back and block the airway. To open the airway, place one hand on the forehead and tilt the head back, whilst using 2 fingertips of the other hand to lift the chin. You need to know if they're breathing normally. You do this by looking for chest movement, listening at the mouth for breath sounds, and feeling for breath on your cheek. Take no more than 10 seconds to do this. In the first few minutes after cardiac arrest, a victim may be barely breathing or taking infrequent, noisy gasps. Don't confuse this with normal breathing. This is when you'd need to use the call, push, rescue skills that you've already learned. If they are unconscious but still breathing normally, you need to put the casualty into the recovery position. This allows the tongue to fall forward, keeping the airway clear. It also reduces the risk of any vomit blocking the airway. Kneel beside them and, if they're wearing glasses, remove them. Make sure their legs are straight. Place the arm nearest to you out at right angles to their body, elbow bent with the palm of the hand upwards. Bring the arm furthest from you across the chest and hold the back of their hand against the cheek nearest to you. Then with your other hand, grasp the far leg just above the knee and pull it up, keeping the foot flat on the ground. Keeping the hand pressed to the cheek, pull above the knee to roll them onto their side towards you. Adjust the upper leg so that both the hip and knee are bent at right angles to prevent them falling onto their face. Tilt their head back to ensure that the airway stays open. Adjust the hand under the cheek if necessary to keep the head tilted. And check their breathing regularly. If you've not already done so, send someone to phone 999 for an ambulance. If you're on your own, you'll need to phone for an ambulance yourself. The operator will connect you to the ambulance service and will ask you some questions such as your telephone number, the location of the incident, and what's happened. Remember to stay calm, listen carefully, and speak clearly. Answering these questions is important and won't delay the ambulance. Once you know help's on its way, stay with them until the ambulance arrives and recheck for signs of breathing at regular intervals. So, to recap, let's look at that procedure one more time. Make sure the casualty, any bystanders, and you are safe. Then check response. "Are you all right?" "Help! I need some help over here!" Next, you need to open their airway. Place one hand on the forehead and tilt the head back. You need to know if they're breathing normally, listening at the mouth for breath sounds, and feeling for breath on your cheek. Make sure their legs are straight. Place the arm nearest to you out at right angles to their body. Bring the arm furthest from you across the chest and hold the back of their hand against the cheek nearest to you. Then with your other hand, grasp the far leg just above the knee and pull it up, keeping the foot flat on the ground. Tilt their head back to ensure that the airway stays open. And check their breathing regularly.